Welcome back to Uncovered, everyone. Today we have our resident physio back on our podcast with us. Welcome back, Simone.
Thank you for having me.
No worries. So we are doing a three-way call as well for this episode. So bear in mind with us, we're just getting used to each other talking as well. But we really wanted to get Simone back to talk about so many different topics. But today, a super important one that every pole dancer experiences is twisted grip. So it's one of our grips in pole that most people end up using. Most people find it, sometimes easier than other grips, and you can do lots of different transitions. You can make it really interesting in routines, make different shapes and whatnot, but it can get a bit of a bad rep. So we wanted to talk to a physio about it, about the mechanics, about how it all works and how we can best support our own bodies to perform this move. So Simone, do you want to dive into a little bit, I guess, about what is twisted grip and what our body looks like when we're doing that?
Yeah. Okay, so twisted grip is, anatomically speaking, full shoulder flexion. So basically arm lifted completely overhead to usually about 170, 180 degrees. Full internal rotation. So internal rotation is where the thumb is going to be pointed forwards when you're overhead. So you have to rotate the arm 90 degrees so the thumb is facing forwards. And that is basically your twisted grip position. There's a few other things that's required to perform the twisted grip. So you need some really good shoulder strength, obviously, to sustain that position. But anatomically speaking, it's flexion and internal rotation. And it does have a little bit of a bad rap, unfortunately, in the pole community.
Yeah.
Is it like, why does it have the bad rap? Is it because there's been numerous number of injuries? Like, I assume any trick that we do, we have there is a risk of injury if we're not strong enough, mobile enough, flexible enough.
Yeah, it's really interesting. So I think the reason why it has a bad rap is that there's been a few really vocal and well-known instructors that over the years have had a bit of a personal dislike or, grumble with twisted grip, and that's fine. Like, it might not be something that their body is really comfortable with, and they've been quite vocal about it. There's other, studios and countries where it's fascinating to see they just don't teach twisted grip, and it's been kind of like passed on through generations of pole instructors. It's like, well, my pole instructor said that this is not something that we do, so we don't do it and we stay away from it, and they haven't even tried it themselves. So it's really fascinating. It's kind of like passed down the line. But in reality, like what you said was pretty spot on. You have a risk of injuring your shoulder in any grip that we do. The research, the very limited research that we do have, probably the best is from Joe out in WA. And, Joanna basically showed us that in a study of 103 people, 21 of them had shoulder injuries. And out of that 21, 6 of them were twisted grip. So the other 15 injuries that occurred in that study were basically related to inversions, increased volume and overload, handstands, direct impact, and loaded external rotation. So the complete opposite position of twisted grip. So whilst there is definitely a risk of injury in a twisted grip position, it's not that it's the only way that we can injure shoulders. And in relation to the other number of shoulder injuries, it was actually pretty on par. It was maybe slightly marginally higher than the rest.
I know I injured myself doing twisted grip. However, I wasn't warm enough. It was like a show night or something, and it was at the end of it, and I was practicing. And I think it really came down to I was training too much and I wasn't warmed up well enough for the move. So I don't necessarily think it was the move in particular, but because of that, I did steer clear of it because I prefer a cup grip anyway. So that was my preference. So I would go down and do cup grip handsprings anyway. But yeah, there's so many elements that can make up an injury, I guess, and so much of that can be missed in the journey to the injury.
Yeah, I think that the volume and the overload is the big one. So we've got all the research. That's fantastic. Well, not all the research, but we've got some research now. We've also got clinical expertise. And I think over the last couple of years, the amount of shoulder injuries I've seen, the proportion of them that are, twisted grip related injuries, it probably stacks up very similar to Joe's thesis. But I would say that most shoulder injuries do occur from an overuse overload factor. So it's not a twisted grip specific thing always. It's just in general, you were, in that sort of beginner skill acquisition phase, you're trying to overload your body too much. You're effectively just trying to smash it out so you can get the trick. And people are more likely to hurt themselves doing it like that. Or they're just not listening to their body. They're overtraining in general. And they're just fatigued and... Yes, the twisted grip is a slightly less forgiving position than other grips out there, and we can go into why later on. And that may mean that your risk does increase potentially in twisted grip, but it doesn't mean that it's inherently a bad grip to do, or something that you should stay clear from. And in fact, I've always argued that if you're able to do twisted grip, it shows that you have really strong, robust shoulders. And that's something we want to aim for when we pole dance, is to have really, really strong shoulders to be able to handle anything that we do, as opposed to avoiding a trick or a grip because, it's like, oh, that's just not suitable for us.
I think as well with twisted grip, I found that when I first started pole, when I was doing like a twisted grip handspring, I was starting in a super, super external rotated position like this to kick up into it. And then I sort of learnt from a few people and sort of started standing out from the pole a little bit rather than putting a lot of weight into my arm like that. Is how you start important as well with that twisted grip?
Yeah, absolutely. I think one of the things that we can do is, multiple things we can do, but one of them is definitely change the body position to put ourselves in a little bit more of a comfortable way that can improve shoulder activation and deload the top shoulder. The simplest thing we can do is actually push with our bottom arm. It's something I've said many times, is that people seem to forget about the fact that, when you're going up into a handspring, that bottom arm needs to be doing a lot of the work. I probably even suggest it needs to do a little bit more work than the top arm sometimes. And I've certainly found that when I was learning my handspring, that I relied so much more on the top arm to do most of it when I started out. But, as I got more comfortable with it, in reality, it was just that bottom arm doing all the push. It's so much easier to push yourself away than to pull yourself, towards. Yes, they need to be working in harmony, and your abs need to be working all of it together, absolutely. But it's just some small little tweaks there in terms of, conscious thought that will make a big difference.
Yeah, and I guess with the twisted grip, like say handspring, for example, or Aisha, when you're tired or fatigued, you can kind of hang off that arm at being straight. But if you're in a cup grip or a standard grip, if you can't quite hold on and that bicep goes strength, you're more likely to fall down. So I think that I see a lot of people in that twisted position that are hanging off a lot. And like you said, not pushing through that bottom arm. So I guess it can put it in a little bit riskier position. But also, twisted grip is not just done in a handspring or Aisha. There's other moves that your arm is in that twisted grip position, and it's not in an ideal position. So I think that, definitely, like you said, making sure that your body is prepared and strong enough to be able to do those moves first, and then they are okay to do.
Sorry, you go, Simone.
No, that's okay. I was just going to say that's a really important thing to know when it comes to twisted grip, is that when our arm is in that overhead position, all of our muscles are effectively put on length, and when we're in internal rotation, when we're internally rotated through our shoulder, so when we're no longer in our true grip but in our internal rotation position, that then puts our external rotation muscles on length. So that makes it exponentially harder for those muscles to activate. Trying to pull your body up, if you had a pull-up bar, trying to pull yourself up from here is going to be much harder than trying to pull yourself up from there. It's just because of the length of the muscles. So being in that twisted grip position with your arm overhead and internally rotated, it makes it much harder for your body to, engage and lift up.
So obviously you can do a twisted grip handspring where you're coming up. What about coming down into a twisted grip Aisha? does that put a different strain on that top arm?
So as in you've set up for a butterfly and then you're going to it from that way? Yeah. It's completely different because of the load you're putting through. So I guess when you're in your handspring position, you're kind of starting with your arm in a bit of a lot more rotation and a little bit of a side lean to your trunk, which then changes the pull of the muscles and the load of the muscles. When you're in your twisted grip Aisha, your arm's no longer at full shoulder flexion in terms of that position. It kind of comes down to about 150 degrees of shoulder flexion, which makes it easier for the shoulder to stabilize in that position. So that's kind of the big difference in terms of your handspring position when you're starting and your arm is almost in 170 degrees of full flexion in that start position of your handspring versus your end position of your Aisha twisted grip. So there is some differences there in terms of mechanical load that goes through the shoulder. Yeah. So it is easier technically to do your twisted grip Aisha from your butterfly as opposed to transferring up from your handspring, but that's kind of, doing a handspring is obviously much harder than an Aisha anyway, so that's kind of part of the common sense there. Yeah. It's one of these things that I think with the twisted grip. Sorry, I just completely interrupted you guys. But it's one of these things that I know some people really either love it or they absolutely hate it, and I guess people just haven't had much of an understanding to figure out why their body doesn't like it, or they haven't necessarily broken down the move and gone, okay, how can I address this? Why is it that my body just doesn't feel particularly natural in the twisted grip position? I think if you can understand the breakdown of how the shoulder works, it makes things a lot easier to then work towards.
Would it be true then that some people's, because all our bodies are different and we know that all our bodies are different, would it be true that some people's bodies are not suited or not as well suited to do it? Or is that something that we can look at the mechanics and sort of assess that?
So if we're talking about, if we take injury out of the equation, so in a perfect world, no one got injured no matter how many times they attempted it. Handspring, how good is that?
Amazing.
Yes, there are some bodies that are more suitable than not. So, and that comes down to one very specific factor, and that's strength. It has nothing to do with anatomical position of different joints and bones and bits and pieces like that, because when we put injury back into the equation, what we know is that people who have slightly different anatomy of their bones, so for example, they might have a little bit more of a sloped collarbone or an extra bone spur or anything like that, or reduced shoulder space, they are not necessarily at higher risk than the next person of developing shoulder pain. And that's been really fascinating research that's come out in the last sort of 5 or so years that's basically shown that people who have shoulder pain actually seem to have more space in their shoulder joint. And we know that there's no correlation with bony anatomy of injury. So there's a few different things there that I think are interesting and worth delving into. But the key factor here is to what would allow one person to do a twisted grip handspring compared to another person to not do it. It comes down to strength and capacity. And that's the key differences there from our genetic makeup.
So I know we want to dive into the anatomy of the shoulder, but what strength should people be looking at before they even start attempting this move? Like if we were to give them a strength marker, and I know it's probably different for everybody, but what are the types of strength you're looking for somebody to be able to safely do this move?
So that depends on the specific move. So because if we're talking about twisted grip's in a lot of different moves. So twisted grip shoulder mount, twisted grip Aisha, handspring, your skater or ballerina or music box dancer, depending where you come from. They're all twisted grips. So for me, your music box dancer, your ballerina, skater, that is one of the harder ones that you can do because you are required to keep your shoulder right at 170 degrees of flexion or 180 degrees and internal rotated position the whole time whilst you're in that particular move, unless you're going to take your hand off and do some sort of variation of it. That's that's really hard. So that is technically a much more uncomfortable position for twisted grip, and some people might now start going, oh, I remember when I was in, intermediate or advanced level and trying to learn that particular move, and that just kept on driving my shoulder pain. That's why your shoulder doesn't like that position of internal rotation. Versus, say, something like your twisted grip shoulder mount, you actually start right in that position, but because you're lifting up into it, you're taking your shoulder out of 180 degrees and you're coming more to a neutral position of about 90 degrees or so. So that might be more comfortable versus your handspring, you start right in that position, but you're putting a whole lot of body load through that. So you're doing a split grip position, which puts a little bit of a different load between both shoulders, whereas your shoulder mount, both your shoulders are kind of doing the same pulling action. So there's a few different factors there to think about when it comes to individual moves. So in terms of going back to your original question of, is there a strength set that, you can go, this is the ideal, situation that we can tick off all these boxes and then you know that you're safe to do it. I've kind of gone into that in the past with some of the screening work that I've done in some of my anatomy blogs. So on the bottom of the anatomy of a handspring blog, there'll be a whole bunch of different screening requirements. I can't remember them off the top of my head, all of them, but they would be there basically going, if you can do this, and you can safely Aisha and your instructor thinks you're ready for it, then it would be less likely that you'll injure yourself and you're ready to proceed to do your handspring. If you want to screen, are you ready to do Aisha, then you need to be able to do X, Y, and Z to then pass it on. In terms of twisted grip screening, like just specifically twisted grip, not the actual move, I sort of say to people that you need a minimum of 180 degrees of shoulder flexion to do twisted grip. Sorry, that was a huge tangent. No, but I just kind of wanted to make it clear, because I think people get really confused and go, oh, I've got 180 degrees of shoulder flexion, I can handspring now. That's there's a lot more that goes into a handspring than just 180 degrees of shoulder flexion. But you need it. And the best way to test it is against a wall, sitting down, because it puts our lat muscles in this stretched out position. And that's, if your lats are limiting your shoulder range of motion, then when you go to activate your lats when you're pulling up into a handspring, they will limit your shoulder range of motion, and it's more likely to lead to shoulder injury or shoulder pain. So that's the first thing you want to do, is check that you've got full shoulder flexion. And the second thing you want to do is check you've got full shoulder internal rotation. So quite simply, it is ideally about 80 to 90 degrees of shoulder internal rotation. So at the moment, for those who aren't watching the video, my arms are out to the side, and then I'm rotating my hands down into a scarecrow position, versus 90 degrees of internal rotation overhead. So you lift your arm up to the roof, and then you turn your thumb so it's facing forward into internal rotation. So if you don't have those two things combined to start with, then you're not ready for twisted grip. The third thing we need is really good external rotation strength. And this is because when we put ourselves into a position of internal rotation, like I mentioned before, all of the muscles around the shoulder are placed into this lengthened position. And the ones that we're really wanting to focus on are external rotator muscles, also known as our rotator cuff muscles. Most of them externally rotate. So these guys here, so you'll get my shoulder out, the muscles that sit at the back of your shoulder blade, they basically wrap around to the side and even towards the front of the shoulder. So if you go to rotate your shoulder and place it into internal rotation, it actually then stretches these muscles out further, and then you add full shoulder flexion to it as well. So it's a lot. There's a lot that's happening on the shoulder that your muscles have to then have the capacity to handle. So if your external rotation muscles that are already tiny little muscles are then placed on stretch into full flexion, and then placed on further stretch into internal rotation, if they don't have the capacity and the strength to handle that position, that is more likely to increase your risk of injury. So what we want to make sure that you can do before you go into internal rotation is that you can stabilize your shoulder and have really good rotator cuff strength right at end of range flexion. So I quite often get people to do this particular exercise called break the bar. So with a resistance band, hands in front, and you're rotating the band. I usually get people to attach it to a pole for twisted grip specifically. So I'm just going to lift my camera up and pretend one of my hands to the pole. Oh, can she get range? Yep, there we go. So my arm's supposed to be at full flexion, but I'm going to hold it out, and then I'm going to work on this rotation motion to actually see if my external rotation muscles are strong enough to handle the load in this position. So I'm going to be at full 180 degrees of flexion and then working my external rotation muscles. And you just need to work one arm at a time to see how it goes. If your shoulder can do a good 10 to 20 of those on both sides, and it can do it without fatiguing, without losing control. So it's not about trying to yank it around and see if you can do it. You should be able to control that movement nice and slowly and not experience any shoulder pain or discomfort. If you can do that, then you're less likely to injure your shoulder in twisted grip, as opposed to you just going, okay, don't have the range, don't have the strength, but I'm going to try it anyway. That's kind of just, asking for a disaster to happen.
I was reading your Twisted Grip blog before we jumped on, and you've got this nice little flow chart in there too that people can follow. So I'll make sure we capture that and share it, and we'll link all the blogs below if people want to obviously read these as well, because they are extremely helpful. All of your blogs are very helpful, but that flow chart was really cool because you could actually go am I ready for this? And you can follow it and determine whether or not it's time to get twisted.
Yeah, I think, if you have really good external rotation strength overhead, then you're naturally on the pole going to engage the rotator cuff muscles and break the bar. That's that constant cue that I use. You need to always try to break the bar to engage your shoulders to make sure that you're protecting the joint before you then lift up into a handspring.
I had a question from before when you said the exercise where you put the one arm up. Is it make any difference, or is it going to be helpful to train that with two arms up? I know for handstands and obviously, but then when we're doing our Aishas and stuff, we use the one arm. So what is the difference between the one and the two arm, or is there a difference?
Great question. I always train it with two arms up, to be honest. So if I'm using it as a screening test, then I will use, for twisted grip specifically, I'll use it as one arm because you're using that sort of split grip position. But when I train, or when I get people to train it, I usually train it with both arms. And the difference is it's actually harder with both arms because you're basically putting the band on more resistance and as a result fatiguing the muscles more. There are some exceptions, always exceptions to the rules. There are some people who may be really super strong with one shoulder and weak on the other side, and then they're compensating on one, and you can see that they're just not engaging correctly. So you might have to isolate one shoulder specifically, but generally speaking, most people are weak overhead with their external rotators on both sides. So it's one that I like to train both. Yeah.
And the other thing I had was, is there such a thing as someone having too flexi of the muscles in the shoulder? When you got your shoulder out before and you turned it, I was kind of that was real cringy and tight. But you have those people that come in and maybe they've been ex-ballerinas or whatever, and then their arm just goes up and over and back, and it's just how would they then go about, or is it the same principles and concepts of they might just have to not let it go too far back?
Now you're talking about hypermotor patients, which we're going to do hopefully another episode of shortly. So we can definitely cover this a lot more in the that podcast, but absolutely, those particular polars, they need to be really mindful of engagement because they're the ones that they're not using their muscles subconsciously as what they should be doing, and they're more likely to hang out of the joint. And I guess when I'm saying hang out of the joint, it kind of means that the active structures or the muscles around the joint aren't providing the support, which then means that the next thing in line that will take the load is the passive structures. So your ligament, the joint capsules, the bones, all of the musculoskeletal structures, and that can then get really sensitive and irritated, and that's what then leads to shoulder pain.
But will that be a different kind of injury to someone that would that be more of a ligament, or do you know what I mean? Is it?
Yeah, I think this is where you get now complicated a bit, and this is where there's lots of debate in the physio world about this. In terms of like how we would treat the injury, we'd still assess it the same way, and we'd still sort of follow a very similar treatment approach. In that, we need to figure out what's driving the pain. So for those particular patients, the difference would be that they might be hypermobile and unstable in the joint, and so then we need to work on a few other different things that address their individual need. But in terms of the actual injury or structural damage, it's probably very similar. It just, instead of it being maybe like a very pinpoint specific ligament, it might be that there's just nerves that are irritated. Versus, like, you can have a whole spectrum, right? You can have it all the way from ligament through to joint, all the way through to rotator cuff tears. So there's always going to be a huge spectrum. I don't necessarily think that the hypermobile population more likely to have always rotator cuff tears compared to a non-hypermobile population. It's just that we kind of have to treat them slightly different in terms of adding in some like huge focus on stability. I hope that answers that.
Yeah.
It's very confusing.
I guess the key thing is you don't want to let it get to that point at all. You want to always try and train before that, because then it can be, your body is so complicated. So even when there's like one area that's pain, it might be from another area, which we have talked about in the past. And
And the other thing to just, and again, we'll go into this in the hypermobility one, but the other thing to prelude is that hypermobility doesn't mean flexibility. So you can be hypermobile and only get to 150 degrees of position because your shoulder stops you from going further because it knows that you're at higher risk of damage. So you can be just a very highly mobile, connective tissue, atypical person, and as a result, you put more load through your shoulder joint. So that kind of gets very challenging for people to understand when I sort of say to them, you're hypermobile, and they're like, I'm not flexible, and I'm like, no, you're hypermobile, very different. So when it comes to the shoulders, it's definitely something in pole dancers that we need to be aware of. And you can also get trauma-associated hypermobility that happens over time. So if you continue to push yourself in your twisted grip and your body's not capable of it, you can actually then cause ligamentous and musculoskeletal damage that over time makes the shoulder joint more unstable and then predisposes risk of greater injury down the track.
Interesting.
So that can also happen in any other grip.
Yes.
Important to note. So twisted grip is not evil at all. It's about whether you have the capacity to handle the demands of twisted grip, which is, I kind of am going to pull this back a little bit to a conversation that's been happening the last few days about, should I learn twisted grip or true grip, and, what one should happen first and so forth. And I guess kind of the easiest way to explain it is that true grip or straight grip is it's your neutral position. Your body is going to naturally feel way more comfortable in this position, and you should ideally learn this trick or this grip first. It is just, generally speaking, a safer position for the shoulder to be in because we have a little bit more movement available in the shoulder space, as well as our muscles are in this kind of neutral position. They're not in a lengthened position, so it makes it easier for the shoulder to control. A lot of people turn around to me and say, but I feel much safer and I feel much stronger in twisted grip. And there's a really simple explanation for this, and that's because internal rotation of the shoulder or twisted grip puts you into this closed pack position of the shoulder joint. And that closed pack position doesn't mean that you're using your muscles correctly. It means that you're loading up your joint more, and you're getting passive stability from the actual structure of the joint, not necessarily from your muscles. So whilst it does sometimes for some people feel a little bit more comfortable, it's not necessarily a sign that you're using your muscles correctly. So ideally, we should learn in your neutral or your straight grip, or your true grip position first. There are just some people, though, that are really super strong and they have capacity for twisted grip from the start. So there's lots of people out there who don't even learn their true grip, they learn their twisted grip, and it's completely fine for them. And that's because their shoulders are just strong enough to handle the demands. They go into this lovely internal rotation position and their shoulder is happy. It's happy as Larry. Its muscles are working fine. Everything's, A-okay. And it doesn't mean that they've done anything wrong by learning twisted grip first. It's just a potentially for some people it may be a bit more of a precarious position if their shoulder doesn't have the strength and capacity. So in my ideal world as a physio, I would love for studios to teach straight grips first, Or, if you're going to teach twisted grip first and you're not going to teach straight grip, then maybe screen your students to make sure that they're ready for twisted grip, because it does put you at a slightly in a slightly more challenging position for the shoulder. That's probably the best way I can say.
I think sorry, you go, Steph.
So when you talk about this packed position, I imagine, and for those listening, is this like does your shoulder have room in it? She's about to grab at her shoulder if you're watching on video. Does your shoulder have room in it? And then by doing it, you're removing that room in your shoulder? Okay.
Correct. I'll get you guys, everyone listening, to play along in a second and do something. But the best way to explain it is anatomical cadaveric studies. Cannot speak.
That was a big word.
Studies on dead people. I know. Oh my gosh. If anyone who knows right now, I've just come back. I'm kind of like between holidays. I'm on annual leave, so my brain's kind of like halfway back home, halfway not. So basically, they've shown that the shoulder space has anywhere between 2 to 17 mils. This is the subacromial space. So for anyone who is a little bit of a nerd, knows their anatomy, this is basically the space that sits underneath your acromion, so where the collarbone comes and joins to the shoulder blade, as well as the humerus. So that space there is usually anywhere between 2 mil to 17 mil. Now, what we know is that when we pop our shoulder into internal rotation, that reduces the space to closer towards that 2 mil position. Okay? So that doesn't sound like a lot. It's enough for the shoulder to function. It's not concerning. It's not a position of pain. It's completely fine, right? So it's not a worry. But it is less space for our shoulder to have leeway with. So that's kind of one of the important things to know. If I get you guys, so now this is what I was saying about playing along at home. If I get you to lift your arm overhead, normally you'll hopefully find that it's comfortable, it feels good. If it doesn't feel good, you can create some extra space in the shoulder by elevating your shoulder blade. So you can think about lifting your tip of your shoulder up towards your ear and then raising your arm up. So for some people that might feel more comfortable, for other people they might go, that feels gross. Not a worry. It's just about learning what's happy for your shoulder. Now try and do it in internal rotation. So thumb down to the floor, no shoulder elevated, just relax. Now try lift your arm. It feels pretty gross. Yeah, that's because there's less space for the shoulder to move and function in. So we need to rely on other muscles more around the shoulder to actually perform that position. So if you now elevate your shoulder before you go into that position, it should feel a bit more comfortable. Yeah. And that's just because we are elevating our shoulder blade more, which creates more space available in that subacromial area, and then more capacity for the muscles around that area to work in a better or more ideal motor control.
It's like magic, guys. You need to actually watch the video and do it with us. It's just, it does make you then sit and realize, oh my gosh, this makes sense. And the fact that we kind of need to have a bit of an understanding of anatomy, even as students, it is really good to know what your body is doing and how your body works, because then you can, like, especially if you are wanting to be an advanced pole dancer or compete or anything like that, having a bit of an understanding, because when you're doing it in a routine, you're not thinking, oh, I got to elevate my shoulder. Like, you're just doing it naturally. So, well, not naturally, but also like subconsciously, you're just going into what you've trained. So making sure that you know what you're doing would be really, really important.
So this takes us to our really important truth bomb that still many people don't understand, and it's that when your arm is overhead, you need to elevate your shoulders. So your shoulder blade should not be pulled back and down when you're going to lift your arm overhead. We need our shoulder blade to upwardly rotate to then help with humeral elevation.
So, do you know where, Simone, this back and down has come from, or what move what is the best move why we do back and down? Is it for pulling?
Bloody ballerina. No, but seriously, that's it. That's literally it. They've been told, and it's fascinating because I know quite a few, I know the Australian Ballet Physio, I know a few other people who work in that sort of field, and it had been happening for many years, and it was a pure aesthetic thing. It was to make the neck superior longer and the lines. Yes, it was a more beautiful position to be in. Sometimes we do that in pole where we hyperextend our knees to create extra lines to make it look long. It's not necessarily the safest position or ideal position to be in when we can do things different ways. So that's where it's come from. And it's just one of these really shitty little just sayings that has been so hard to break. And trying to tell someone, don't pull your shoulder blades back and down. You actually want to elevate. Instead, they're literally the opposite. So it's kind of like you're challenging their whole body system. For some people, it's mind-blowing and they just refuse to accept it. And in reality, the shoulder blades are very dynamic structure. It needs to be dynamic structure. And when we're doing any sort of pulling motions down by your side, it's okay for the shoulder to sit down a little bit. That's not an issue. In fact, most of the times it kind of needs to sit back and maybe a little bit down to engage closely. But as soon as we start to elevate the arm, the degree of shoulder elevation needs to lift with the actual the humerus as well. So it needs to be, functioning as a whole team. It's an orchestra, the shoulder. Everyone has to play their part and every muscle has to do their own thing. And if they're not in sync and playing together, then the song's a bit screwed up. It just all needs to be the right timing and, the right amount. You don't want the brass overpowering, the violin. You need different muscles working correctly and at their different capacities that they're required.
Yeah, and you said something really interesting before, like, the extended legs, or that looks really pretty in the position. It might be not the safest or ideal, but it looks really good. So what do you think about, I guess you being a physio, when people are performing and they want the best picture or they're doing a photo shoot? How can people manage, they're wanting to do a dragon's tail, which that's behind your back, and then people's wrists and shoulders are in this, we say, horrible position. But is it managing then how often they do it and trying not to overtrain it? Because I guess you would never really want to put your body in a position that it's but that's all elite athletes. Everyone that's an elite athlete would put their body in a really extreme position.
Yeah, pretty much. More so circus, pole, contortion. And dragon's tail is a perfect example because dragon tail is a position of tabletop, internal rotation. So it's the difference between dragon's tail and, your twisted grip is twisted grip has flexion, which makes it a little bit more challenging to stabilise the shoulder joint. But dragon's tail is still loaded internal rotation, which is still quite an uncomfortable thing for a lot of people's shoulders to do. In reality, it comes down to the fact that we talk about does your body have the ability to actively control it? And so if your muscles around the joint aren't actively protecting you, then no, that's not a trick for you at this point in time. And so how will you know that you're actively using your muscles versus not? It's something that you develop with time and practice and skill and with, physio that targets different areas, rehab, all of that. It's something that you should just gradually learn and have greater insight in your body. It's not something you're expected to know straight away. But if you are a beginner pole dancer, never done anything before in terms of exercise in your life, and then within 6 months you're working on a dragon's tail, I could pretty much guarantee you that you're going to stuff something up big time. So it's just going to be because you don't have that trained expertise and experience and body awareness. It's something that is a bit of a lifelong journey.
And I guess that even though I see people that can do a move and they're like, yeah, I can do a dragon's tail, but it's well, you're creating the shape. But and that's the biggest thing I struggle with as an instructor, because I can see people are not quite doing it right, or that it's just something wrong about it, that they're doing the move and then they're like, yeah, this is a tick, I can do it. And then it's well, and I guess what you said, it comes down to a lot of your own personal knowing about how that feels. And you can't really tell anybody if someone's just going to go ahead and do those moves. You can't just tell them, no, they're going to do it if they're going to do it. But we can educate people and sort of say we want to be able to support ourselves in this position and not have any pain doing it.
Yeah.
And we talk about this a lot. Everyone wants to go from 0 to 100 so quickly. And being in the industry now for 10 years, it is a journey, and you want to be here for a long time if you love it. It's not worth risking yourself in those early stages. But because you can achieve these sometimes maybe not without the right technique, without injury, you continue to just think your body's okay and you continue to go and do these things, even though it might not be in your best interest.
Mm.
Just because you can do a trick doesn't mean you can do a trick.
Yes.
Ooh, I like it.
I just seen Charlie Love share something on TikTok. He was in this like horrendous looking trick, and he's like it looked like creepy. Yeah, and he's like, just because you can do it doesn't mean you should. Like,
yes.
I seen it and I'm like, I kind of want to share this because it's so true. Like, yeah, you can physically do this trick, but it's not pretty. So like, so I think it's a really key takeaway.
And again, it's like, doesn't mean you can't work towards a trick. It doesn't mean that it's forever going to be that way. It's something that you may need to break down a little bit more detailed and work on it bit by bit. Not the trick necessarily, but the individual components of the trick off the pole and then on the pole, and then work on a few different elements of it to then help bring that trick together. Just the amount of times I have patients come to me and, you know, they've come to me with an injury and we've worked on something, and then they have gone and attempted something that they haven't maybe tried for 6 months, and in that period of time all they've been doing is rehabbing a part of their body that they didn't think was related to that trick, and suddenly they can do that trick. It's just happens way too often, and all they've been trying to do to try and help get the trick is like they've been trying to work on it. For example, an eagle. I have this beautiful patient of mine who, you know, didn't even tell me she was working on an eagle, and not a worry, was rehabbing some stuff around the hip. 6 months later, tried it, and then bang, had an eagle and sent me, you know, a message was like, I've done nothing to work on this, and I've done no flexibility training. I've done absolutely nothing. Literally all we've done is our hip.
Wow.
And I was, so it's the same with the shoulder. Like what I was saying before with the hypermobile population, it's not just hypermobile population. Our body's fascinating. It will protect you. It will not let you access range if you don't have the strength and capacity to. Well, in the ideal world, that's what our body does. In some people, unfortunately, their body just goes a bit too far. But for most people, our body will actually stop you from accessing range if it knows you're going to injure it. So it won't let you access a deeper split, like a deeper middle split, if it thinks it's going to be structurally at risk, because you don't have the stability and the support of the muscles, which is why we need to work on things like active strengthening when we're talking about flexibility and mobility. Whole different topic.
And also everything ties in together, but then like I was thinking, when you're training it and when you're working on it and then giving your body time to recover and getting used to those changes, to then work on it again after is really important, and we have to have lots of conversations with people about recovery as well. So that would come into all pole moves, but with the shoulder, I'm guessing is the same. Like when you're obviously that you just you're training it, you're wanting to give it time to strengthen and recover.
But also with the shoulder, you use it in so many other things too. So even if you're like, I was training twisted, but like I probably overused it a little bit here, but now I'm going to go train this other grip. Like it's hard because our shoulders are in everything.
Yeah. We pole dancers are upside down people. Like we have been taught how to walk on legs for all of our life. Like you look at any other sport, effectively it's pretty much on legs, and we are now flipping our body upside down and weight bearing through our hands, and our shoulders are the big muscles here. Like our hips are our big muscles. They are our big protection muscles. So when we do any sort of weight bearing activity, like, you know, any sort of other sports, they kind of are the big drivers with your abs. And now suddenly our shoulders, which is an inherently unstable joint, it really doesn't have much to it. That's now suddenly supposed to be our big area. So it really does make it challenging, and we need to be careful, and we need to be mindful of what we're doing to our shoulders for longevity. And, you know, that's a very much so a big one with pole, is that we want to be here in 10, 15, 20 years to come. I mean, hell, I want to be pole dancing when I'm 70. Like, I don't care what I'm doing, but I want to be doing something. So, you know, like, I want to be active and make sure that I'm still doing it for life. So it's really important that we protect ourselves.
100%. And if we... Oh, sorry, do you have a question, Renee?
No, I was just going to make a statement, I guess, because we have talked about in the past, like, different things that affect you for pole or training, such as age, like you're saying when you're 70 and whatnot, and like weight, gender, everything has an effect. But I guess the key takeaway to this podcast and about Twisted Grip is having that strength to be able to support. So no matter what age, what gender, what size or anything, if you have the strength, then this is an achievable move for people. So, yeah.
Yeah, absolutely. There's a whole bunch of internal risk factors and external risk factors that we can, look at that basically determine our risk, injury profile or injury risk profile when it comes to something like a twisted grip injury or any other shoulder injuries. And in reality, we can't change a whole bunch of them. There's not much we can actually change. The big thing that we can change and the big thing that we should change is the strength and capacity of that area to handle the demands of the trips. And I mean, it kind of flows in a little bit into shoulder injuries, and I know there'll be a whole bunch of people listening to this particular podcast because they're, fascinated by twisted grips, but most likely because they've actually then gone and hurt themselves or currently have an injury and so forth with their shoulders, or they keep getting injured, they recover, they take time off, and then they, shoulder feels good again, they attempt to twist it, and then it just kind of is this perpetual cycle. And I think, with these sort of patients, it's really, polars. I keep on using polars and patients. But I think if that's you, if you're a person listening to this and you have a perpetual shoulder injury or you have an underlying shoulder niggle that just doesn't seem to go away ever since you heard it initially years ago trying to do a twisted grip something or other, I think it's really important that you actually take the time to properly address it, because shoulder injuries don't ever go away if they're not addressed. And quite often there's a lot of patients out there, polars out there, who need to do ongoing maintenance for their shoulder injuries whilst they're poling. So the day you decide to retire from pole, that's the day that you may not have to do your shoulder exercises ever again. But if you are someone that has an injury, it might be something that for you personally you need to keep going with your rehab and working on your shoulder exercises whilst you're continuing to put your body in these, incredibly challenging and, difficult positions. But for a lot of polars out there, if you do your rehab correctly and do it well from the start and get onto the injuries, there's a really good chance you might not have to. There's a lot of patients of mine that I've never had to see again because of the fact that they came in really nice and quickly, they got onto their injury, they got it when it was just a niggle, when it was starting, and it hadn't progressed to instability of the shoulder or a decent injury of the shoulder. They got onto it and they were able to resolve the injury within 6 to 12 weeks with their rehab, and they love their exercises. Like, I tell them that they don't need to do them anymore, but they go, nah, it's a part of my warm-up now for the rest of my life, and they just include it. So it's one of those things that if you are injured, definitely get onto it, because it's really helpful if you do it now as opposed to 2 years later and then try to see me 2 years later and I go, it's a bit harder to treat you when it's kind of progressed down the line.
I think
not impossible, but harder.
I think that's a huge takeaway, because we even have students who come in as like, oh, it's just a little niggly, or I'm just not feeling 100%, but it's like, have you gone to a physio? Have you done this? Have you done that? And it's like, oh, I'm just going to see how it goes. It's like, just get it done.
And it's funny because I know finances are a huge thing. I'm not oblivious to it. It's so funny sometimes people try to beat around the bush with me about this sort of stuff, and I'm just like, I'm a person. Finances sometimes, but I get it. If you kind of turn around and go, I just don't think I have the money for physio, and then you can suddenly go buy a whole wardrobe full of clothes. But I get it that not everyone can afford physio, but there's definitely, if you're in that position, chat to your GP, because there are some, plans and things out there that, you might be able to get onto with your GP, that you can get access to a physio for a short period of time so they can at least get you started on your rehab. But then, the other thing is whole classes aren't cheap either. So I would also suggest that if you're someone who has ongoing niggles and continues to spend, lots of money on pole classes, it's probably time to maybe reassess what the finance situation is there and maybe invest in your own body. Because if you don't invest in yourself, you're gonna screw it up.
And just slow down. If you can't see someone right now, it's like, okay, well, just slow down a little bit. Don't try and keep working on these tricks. Maybe just go back and work on the dance side of pole or anything like that, to not try and aggravate it and make it worse until you can then afford to go see somebody.
It doesn't make you
and in the long term,
any less of a pole dancer if you have to take a step back.
Yeah, and I did a great blog on this where at one point in my time I had to take a step back, and it's just one of those things that doesn't make you any less of a polar if you have to have a break. If you come back, 6 months later, 12 months, whatever, however long it is, it doesn't mean that you're, a failure. It's just not serving you. Pole isn't serving you in that point of your life at that particular time. But I was going to say, in the long term, if you kind of put off injuries, it will actually end up costing you money. So, for many different things, not just finances, it will cost you in the long term.
So true.
100%. So before we wrap this up, Simone, is there anything else you want to add on the whole twisted grip?
Oh my God. There's like so much. Twisted grip, not so much, but maybe like if you are experiencing a shoulder injury, here's my kind of like do's versus don'ts. Do see a physio. Do get it looked at as soon as possible. Getting onto a niggle is, way easier than getting onto a full-blown injury. Don't go to get imaging on your shoulder. That ultrasound isn't very helpful for me as a physiotherapist. If I think that you need further imaging, I'll send you off for it. And the reason is that most of the time, 99% of the time, the ultrasound will come back with some degree of pathology that isn't actually causing your pain. So I think that needs to come down to understanding that most of the time, pain that we experience in the shoulder isn't because of one particular structure that's been injured. Most of the shoulder injuries I see are because the nerves around that area have been sensitized and aggravated because you've overloaded the area, or potentially put in this position and your body's sending you this little pain warning signal to sort of say, hey, stop doing that. I'm going to get really inflamed and upset and angry at you now, as opposed to a structural injury. Okay? If your physio thinks you need scans, they'll send it off for them, or they'll get the doctor involved. And the third thing is, don't go for a cortisone injection before seeing your physio. It's an absolute pet peeve of mine. And I had a lovely gentleman come in to see me a couple of weeks ago. He tore his bicep tendon, and he had steroids before that, and it definitely was a contributing factor to the rupture of the bicep tendon. So steroids are really strong at killing pain if used correctly. However, if used incorrectly, they can actually increase your injury risk profile quite considerably, and are not to be used without physiotherapy input in addition to medical input. I know the medical side of things, the doctors are the ones that obviously send for it, but 99% of the time, most shoulders don't need cortisone injections, okay? So that's probably just a little bit of a pet peeve there, is when people come and see me and they're like, I've had this shoulder pain for years and I've, done everything. I'm like, okay, what have you done? I've seen a physio. I'm like, okay, cool, we'll chat about that in a second. What else have you done? I've had 4 cortisone injections. And I'm like, wow, okay. And why did you have them? Did they work? Nah. First one didn't work, but doctor kept on sending me for them. I'm like, okay, got all these, ultrasounds that show that my shoulder's stuffed. Okay, well, let's have a look at this. Actually, shoulders are pretty normal for someone. Let's go back to the physio. What did you do? Oh, I did some scap retraction work. Okay, well, that's not physio. So you've got to come down to the crux of the issue and go, are you, strengthening your shoulder to match the demands of what you need to be able to do on the pole? Yeah. I came across so
I love all the truth bombs, but like all the honesty in it, like it's you won't hold back. And I think that's powerful though. And I think that's what people need to hear. So yeah, guys, this was another jam-packed episode. They always are when we have Simone on, and we just absolutely love it because we learned so freaking much, and it's great. Not just for being an instructor, but just for understanding your own body. So Simone has a bunch of resources on this already, and we will link them all.
I was going to say heaps of resources that we'll link. So I've got a few different blogs on twisted grip, and then another blog on shoulder pain, and so much on my social media about it in the past that you could definitely check out. But I am also in the next couple of weeks going to release some spots for an upcoming workshop that I'll do on shoulders. So we'll cover twisted grip, we'll cover normal grip, we'll cover shoulder injuries, we'll cover just like shoulder biomechanics and anatomy for the pole dancer, and it will go into way more depth than this. It will be a little bit more structured because I know we've kind of chatted just freely, which is what we do, which is great. But this, as I say, will be super structured. It'll make a lot more sense. We'll go through all the research out there, what's applicable from other sports to pole, as well as the pole research currently, and we'll break it down. And there'll also be practical components. I'll show you how to best engage your shoulder on the pole, and then you can play around with it if you've got access to a pole during the workshop. It will be one of those available live, as well as available for 2 weeks after to watch later on video. We'll do one of those and check it out. I'll have, by the time we've released this podcast, I'll have a link up in my bio.
Yay! And I've done the workshop, and it is very, very good. So highly would recommend. So guys, check out Simone at the Pole Physio. Are you at the Pole Physio straight?
At the pole.physio.
There's always something in there. And otherwise, all the links will be in the bio. But yeah, thank you so much for joining us today, Simone, to cover all things twisted grip. I think it's very topical at the moment, and it's such a great topic just to cover off.
Thank you so much for having me. I love being a part of the podcast.
We love having you.
Yeah.
All right, guys, if you're loving Uncovered, come hang out with us on Instagram or YouTube. This is definitely a powerful episode to watch on YouTube because there was a lot happening on screen. So check us out, Uncovered for Pole Dancers. Until next time, we'll see you soon.